Patient 1 wears support stockings for his varicose veins, and for his diabetes he has to check his blood glucose levels using a finger prick, and he has to do this before a meal and 2 hours after every meal.
Due to patient 1's incontinence, he has to go to the bathroom at regular intervals. At night especially, this affects him more because he's tired and gets fed up with it. Along with this, patient 1 enjoys talking about his conditions as he likes to further students' knowledge, and he gives regular talks to organisations about it as well.
Patient 1 feels his blood pressure is being well controlled by the medication and tablets he's taken, and he is generally happy with all of his medications and his adherence to these.
Patient 1 has to control his own medication. He doesn't like relying on people or devices to remind him when to take them or how often to take them. Along with this, he has a good support system from his sister, but again he likes to be independent and do everything himself rather than rely on her.
So, patient 2, in 2001, he got ill with a virus, and this virus then caused him to have a viral cardiomyopathy, so heart failure, and he then ended up having a heart transplant in Manchester.
Go on.
As he was recovering, he was bored and tired, but at the same time, when he was in hospital, he was worried about bringing his children there. Although he wanted to see him, obviously, because he had the virus, he didn't want them to get ill as a result as well. He's now retired, and he's still active, and in his spare time he enjoys going to the gym and going to play badminton with family and friends.
He also does charity work, gives talks about his medication and how he's his cardiomyopathy. He also worries about catching colds and flu.
He does. At the moment he's currently on 3 anti-rejection drugs, which cause him to have side effects such as they poison his kidneys, so he needs to take other drugs to counteract these side effects, which increases the medication he's on. He was given Ramipril by his local pharmacy, and it gave him coughing and side effects, so he changed his medications as a result after going to see his GP about it.
He also had problems with the timings of his medication, so he found it difficult to take his medications at the right time, but now he's taking his medications in the morning at 7:30 and in the evening at 9:30, so his adherence is now good as he's established a routine.
When we were speaking, he said some of his drugs were specialised as when they were given to him by the hospital and faxed to his GP. Some of his medicines are sent from the hospital by post to his home address to make it easier for him to get hold of his medications which he requires.
So as well, sometimes the pharmacy doesn't have his medication on time, so he then has to chase after them to get his medication on time.
Keep going.
Right. Patient 3 suffers from epilepsy. 30 years ago, she had an embolism that caused her brain hemorrhage.
She lost vision in one of her eyes. She also suffers from seizures around twice a year. When she has a seizure, her vision goes first, and then her ability to speak.
Seizure. In a year, if she has 2 seizures, that means it's not been a good year for that. In terms of medicines, she has specific tablets that she takes in specific times of the day, such as?
She takes atenolol and bendroflumethizac for hypertension.
And she takes cocodamol for pain relief and phenol on sodium for epilepsy. The side effects of the last drug cause her to have loss of teeth and cause her to grow stubble.
The patient has been married for 19 years, and her husband actually gave up his job to take her full time. She feels paranoid when she's by herself because of the seizures and other side effects she has from the medications.
Her experiences of the NHS have been mixed. In terms of when she goes to the hospitals, it's been pretty positive, However, when carers come over to visit them, well, take care of her, it's been the work ethic has been quite compromised because of the pressures that they're under because of the NHS, which leads them to only have like 15 minutes to a range of needs.